Hi, this is Lisa Broyles with Way to Health MD, and I have some special guests today that I wanted to introduce you to. The series I've been doing has been about the book, The Complete Bone and Joint Health Plan. And I have with me Dr. Jocelyn Wittstein. She and I went to medical school together. She probably doesn't know this, but she did kind of help inspire me on my journey to long distance running. And I think I got halfway through the run and she was beating my pants off. And I was like, okay, I'm fat, you keep going. And she did, which was awesome. So she's an amazing athlete. So Jocelyn is an associate professor at Duke University in orthopedic surgery. She also specializes in sports medicine. So thank you, Jocelyn, for being here and talking to us about your book today. I also have co-author Sydney Nitzkorski. She is a registered dietitian and she's also a fitness instructor. So she's been practicing for over 20 years in private practice. And she's got some absolutely awesome videos, both on Zoom and on YouTube. I'll make sure to include the link to her websites if anyone's interested in joining her for her online exercise classes or watch any of her YouTube. I did one the other day with my weights, and I can say, Sydney, it was hard, but I really loved it at the same time. So thank you so much for doing that for us.
Yeah, we like to say between the two of us, we've got about 40 years of collective experience.
That's perfect. And I always tell my patients, I can't know everything, but I do know who to ask. So I always see myself as part of a team of other providers, and together we can help people and have all of the knowledge. There's no way my brain can hold it all. So, but thank you both for being here. So the Complete Bone and Joint Health Plan, you published this book last year. I've read the book, I've studied the book, and I think that everyone should have this book on their bookshelf as a resource. So they talked to us a little bit about just the science behind bone health and how to keep our joints healthy. But then they take a deep dive into foods that will help our joints hurt less, help our bones grow stronger, or even promote bone density where it's lacking. And then they also have a section on what exercises you should do. So, and there's even online further videos with instruction on how to do your own home exercise program, which is essential for strengthening those bones. And I'm just going to dive right in with some questions. So, Jocelyn, I wanted to ask you, I just finished a series on the benefits of creatine, but I wanted your opinion on creatine monohydrate. How safe do you think it is, and do you think it benefits bone density?
So I think creatine monohydrate is incredibly safe. It's probably the most studied supplement there is. And a dose of 5 grams daily has been, widely studied, really in people of all ages. And when combined with strength training, does improve our ability to gain muscle mass. There isn't any evidence that creatine monohydrate in isolation will directly increase your bone density. So they will enhance our ability to gain muscle mass, which then can secondarily benefit our bone density. And resistance training in particular has really the most prominent effect on our vertebral, especially our lumbar spine bone density, and somewhat on our hip bone density as well. Strength training is key to improving your bone density. Think of creatine monohydrate as a way to amplify the effectiveness of your strength training.
And is creatine safe for older people? What about people with kidney disease?
So if you know you have kidney disease, that's something you should discuss with your doctor. Certainly, people with significant kidney dysfunction should probably not be taking the supplement. But for people who have normal kidney function, this is an incredibly safe supplement.
And it's safe for older people as well. And I read that it can improve cognition. So it's one more tool in the toolkit to help with
Right.
our memory
Yeah.
and our bones.
There's some like mixed evolving data on the cognitive effects. And, based on some research, you may need a higher dose to actually see cognitive effects. There's also some evidence that creatine monohydrate might help with, recovery from fatigue. But I think that is evolving. And I think the dose that's been studied regularly and shown to be safe is the 5 grams daily. Some of the doses for cognition seem to be higher. And I think probably more to come on that.
So Jocelyn, I also wanted to ask you, what other micronutrients do the bones need to be healthy? Because I know that we often need extra nutrients kind of as carriers to help us absorb our calcium better. So, do you think that K2, magnesium, what do you think is really important to also take in with that calcium?
And you'll see in our book, we have a table of micronutrients because, micronutrients are very important for bone health. Of course, everyone thinks of calcium as being, the main micronutrient we need for bone health, but we can't get calcium to our bones to mineralize it without some of these other micronutrients. So, magnesium is a necessary cofactor for vitamin D. Vitamin D, of course, helps us with calcium absorption. Vitamin K2 is important for basically activating something called osteocalcin, which, osteocalcin helps, essentially, you can think of it as direct calcium to our bones, assisting with the mineralization of bone with calcium. So all of these things are important. Vitamin C also contributes to cross-linking of collagen. So, that's another micronutrient that's important.
Take those together, like, at the same time? Like, should they take their D with K2 at the same time as they take a calcium supplement or when they eat food containing calcium?
Well, you'll see a lot of vitamin D supplements do contain, also have some K2 in it, roughly 100 micrograms is a pretty
Right.
common daily amount. Now, K2 does have depending on the variation of it, has a pretty long half-life. So it's not necessarily that you don't necessarily have to consume them directly together. And like many things, it's not like immediately gone, for instance. But yeah, a lot of times they are in a supplement together. For people who are vegan, you might want to take a supplement that includes K2 because there are very few vegan sources of K2. It's in something called natto, which is a highly fermented soy product, which I actually just tried for the first time last night, and it is definitely an acquired taste because I don't think I like it.
Yes.
and it's in yeah, like aged cheeses, egg yolks. It's also in, organ meats like liver and, not that many people eat
Right.
liver. It's in some chicken. It's in fermented foods like sauerkraut and kefir. So tempeh has some because that includes some fermented soybeans, not as fermented as the natto. But yeah, so if you're a vegan and you're not getting like any egg yolks, no fermented, kefir, no cheeses, no
Right.
animal products, it might be a little harder because you would be relying on something like maybe natto
Right.
or sauerkraut or
Yeah.
tempeh. Those aren't like the most rich sources. They have many other good things in them. That is a group of people who might definitely benefit from having some K2 in a supplement. And if you look at that list of things that are included, that contain it, and those are in your diet regularly, it's not a massive amount you need. It's just, 100 micrograms per day. One micronutrient, of course, there are many.
Sure. That kind of dovetails into my next question. This is more for Sydney, but I wanted to talk to you about calcium and what our daily recommendation of calcium is, which I know you answer that some in the book, but a lot of my patients ask me, they're like, well, what's the deal with calcium in dairy? Because there's a lot of information. Some people say, yes, we should eat dairy because it contains the most calcium, and others say, well, it's only 30% bioavailability in the dairy, whereas 60 to 70% bioavailability in our leafy greens. But then who's going to eat as many leafy greens as they're drinking a cup of milk? So there's been this back and forth kind of argument. And I get this question all the time from my patients of, well, I can't eat dairy or I'm sensitive to dairy. So am I going to get enough calcium from my greens? I just wanted you to kind of address that bioavailability of calcium in our food, any certain things we should avoid taking our calcium with.
So great question. It depends on how old you are, depending on how, what age bracket you're in, depends on how much calcium you need. But it's somewhere between 1,000 and 1,300 milligrams, which can be a good amount. So to put that in perspective, 8 ounces, which is a fairly small cup of milk, is 300 milligrams of calcium. You need 1,000 a day. The calcium from dairy products, as you said, is about 30% absorbable, which is on the higher side. Green leafy vegetables can be even higher, but the amounts are a little smaller. So a half cup of cooked bok choy is a really good source, but it has 80 milligrams. So you're trying to get to 1,000 or 1,200. It's so hard to get all your calcium from green leafy vegetables. I would say, maybe one day you might do it, but on a daily basis, I think that's nearly impossible. Other dairy products like yogurt are all going to have calcium in them. And then the non-dairy milk alternatives, so cashew milk and oat milk and soy milk and rice milk, none of them are natural sources of calcium, but almost all of them are fortified, which is a really good way to get a good amount of calcium. So usually the amount somewhere between 300 and 400 milligrams of calcium in the milk alternatives. But I always encourage people to look at the label because it's not guaranteed that they are fortified. So most of them are, but not all of them. And we all tend to buy the same products over and over. So if there's something that you buy all the time, just make sure that it's calcium fortified if you're counting it as a calcium source. There are other foods that have calcium, certainly. So things like basil seeds, which are really similar to chia seeds. A lot of people don't know about basil seeds, but they're a little bit more nutrient dense compared to chia seeds. 2 tablespoons have about almost 400 milligrams of calcium. Things like sardines or anchovies with their bones have around 300 milligrams in 3 ounces. So there are a lot of different sources out there. Things like broccoli has about 30 milligrams in half a cup cooked. So great for a million other nutrients. It's not a huge calcium source. It is certainly possible to get all your calcium from your food, but it can be challenging. So what I usually tell my clients is to have a supplement around and take it some days if you need it, and other days maybe you don't need it. So most calcium supplements are in the amount of 500 milligrams. And you should separate it from calcium sources or another calcium supplement by about 4 hours. And calcium and iron don't like to go together. So I always say, like, they're enemies. Calcium and vitamin D and K and magnesium, those are best friends. So you can have them together, but not with the iron. But you, just to capitalize on your absorption for calcium, you do want to separate it by about 4 hours. So I would just encourage people to maybe at the end of the day think like, all right, well, did I have a coffee today with a lot of milk or soy milk that's fortified? Or did I get some cheese or some yogurt that has a good amount of calcium? How many did I have? Am I close to that 1,000 or 1,200 milligrams? And if you are, great. And if not, maybe you take one supplement. You don't necessarily need both of them. Most of the labels will say take 2 because they're assuming you're getting 0 from your diet. But if you're getting some parts from your diet, maybe one supplement's enough. If you're getting 0 from your diet, then you do need 2 a day.
I do think this is such an important topic. Oh, go ahead, Jocelyn.
I was going to say, and we've talked about in the past that some of the concept of your daily value generally takes into account that there are various absorption or bioavailability rates among different foods. Like dairy is quite high. Bok choy is the highest bioavailability of all vegetables. Spinach has very poor bioavailability. So you can actually absorb, similar amounts of calcium from bok choy as from milk, but like spinach is going to be not a great source of calcium. And not that people need to go around calculating all the bioavailability of every source that they take in, but we do try to share in the book, also like which sources are highly bioavailable and which ones are not, to kind of help people, kind of err on the side of choosing some of those.
You talked about in your book how the body will steal calcium from the bones and the teeth when it doesn't have enough. And when I was pregnant, my front teeth crumbled while I was pregnant. And I think it was like my calcium levels, I was not taking calcium. I obviously wasn't eating enough. And I think my body just took some out of my teeth to build my kid's little, frame there. So it's like, well, darn, I guess my kids have my teeth now. But it did underscore for me that I was not eating enough calcium. And I had always thought that we start losing bone when we go through menopause, but turns out, as you shared, even at age 30, our bone bank kind of peaks. And then from there, it's up to us to eat right and exercise and do what you need to do to keep that bone bank high. But it doesn't just naturally get any better after age 30. So that was new information.
And I think a lot of people don't realize that if you're a mom and you have kids, like just your children in their adolescence are accruing the peak bone. You actually accrue 90% of your peak bone mass or bone density by the end of adolescence.
Wow.
There is a little bit more that is gained up to age 25 or 30, but actually most of it occurs in adolescence, which is scary to think about.
Well, and I understand that both you and Sydney were gymnasts, so you were getting your bones nice and strong in those adolescent years and into your 20s. And well, and speaking of that, what kind of exercise do you think we should include in our daily work week so that we can be well-rounded and improve our bone density?
I think it's really important that people do all different modalities of exercise. I'm going to go through the breakdown of what's recommended. And I think sometimes when I first say it out loud, it sounds overwhelming. So just stay with me and I'll walk you through how you can sort of like combine a lot of these things. So it's not, you're not exercising all day long. I think you can get this done if you're doing about 30 minutes, 5 days a week, which is ideal. And I also want to say, like, if you hear that and you're like, oh my gosh, no way, I could never do that. Okay, then start with what you can do. Maybe it's 5 minutes a day. Is that quite enough? Probably not, but that's a good start. And then you can build on it. So if you are able to do about 5 days a week of 30 minutes, then perfect combination, in our opinion, is 3 days a week of weight-bearing aerobic work. So that's things like running or jumping or dancing or hiking, Zumba, something like that. Twice a week of strength training, and ideally getting to the heavier weights, and whatever, that's different for me than it is for somebody else. But ideally by maybe somewhere between 8 and 12 repetitions, the weight should become so heavy that you feel like maybe I could do one more with good form, but not 10 more. If you can do 10 more or 20 more, you're really working in the realm of muscular endurance, which I do think has a lot of benefits for other things. But for bone health, muscular strength is really important. That resistance training, where by that between 8 and 12 repetitions, it's really heavy.
For patients that are older, I have a lot of women that are diagnosed with pretty significant osteoporosis before they ever see me. Some of them have had compression fractures in their spine, and so they're afraid to exercise. Like, am I going to break myself if I work out? So what would you say to these older women that have a pretty significant bone loss already, for what kind of exercise is safe for them that can help them?
Yeah, so we wouldn't recommend for someone like that to go out and start running, right? And depending certainly on where the osteoporosis is in their body, there are some things you should avoid, but at any age, strength training is recommended. And I always like people to start really dial it back. So maybe starting with body weight exercises, ideal if you had somebody who can look at your form, that's ideal, so that you can say like, all right, you've done this squat body weight and your form is beautiful. Now let's try holding 3-pound weights, maybe 5-pound weights, and really slowly building up from there. So never jumping into something and just saying like, I'm going to try this with a heavy weight, but really body weight is a wonderful place to start. And then you can build up from there.
For people with osteoporosis, if you haven't been previously strength training, it's very important to do a gradual, progressive exposure to resistance training. So starting lighter and then building up. And if someone does have, some pre-existing compression fracture or severe lumbar spine issues, there are some, safety tips, avoiding like flexion of the lumbar spine, paying attention to core strength early on. There are PTs and exercise professionals that are what's called Bone Fit certified, which is something that was a program started by Osteoporosis Canada, which is a training for people, both exercise professionals and physical therapists, to initiate those early phases of strength training for people who are in those positions.
We already have our 3 days of weight-bearing aerobic exercise, and then twice a week, ideally not on consecutive days, but if it had to be, I would still take it. Twice a week of resistance training, and then some light impact exercise twice a week. And that could be as simple as like doing 50 hops, take 20, 30 seconds, or jump rope with or without a rope. You don't actually need a jump rope, but just doing that impact of that hopping, or even heel slams, where you're not actually leaving the ground, but you're creating some impact. And then, so those are the things that are the most important for building bone strength. And then it's also really important to work on your balance so that you have less chance of falling and having a fracture. So I think that twice a week balance training for about 15 minutes, and that absolutely can be woven into strength training. So I'm a big fan of being really efficient with my workout. So maybe you stand on one leg and you do your bicep curls, your overhead press, whatever you're doing on one leg, or if that feels not quite doable to you, doing a little kickstand. So you have like a little pressure on your back leg, but most of your weight is on one side so that you're off, balance a little bit, or even working your balance work into your day. If you're waiting for the bus, maybe you stand on one foot. If you're waiting for your pasta to boil, or you're at a kid's game or something, you can do balance exercise. As much as like we've got our, 3 days a week, 5 days a week, all the things that are recommended, I also think it's so important that people try to figure out what they enjoy so that they actually stick with it. So even if it's like, all right, I don't love my strength training, but I can get through it, but I love my dance class. And so maybe do a little bit more of that, and you work on the strength training because it's really important for you, but figuring out what you like so that you continue to do it, I think is worthwhile.
Yeah, I love Zumba, but I would never do it in a class with other people watching. So honestly, I just like to get on Zumba on YouTube and take it out in the privacy of my own home.
I want to add, just like you mentioned, you have a lot of patients who have osteoporosis. I'm sure you have a lot of patients who also have osteoarthritis. And
Yes.
also they tend to be the same people. We love, like, jumping and impact is great. Jumping impact exercises have a special effect on our hip region, which is of course an area at risk for fracture. But as Sid mentioned, you don't have to do a ton of jumping, 2-3 days a week. is great. If you are someone whose joints aren't bothering them, you can actually do a little jumping every day. It doesn't have to be a ton. It could be, 20 jumps a day, something like that, or you could do 30 jumps a few days a week. If that's too much, maybe try just 2 days a week, depending on how your joints feel. And for people who can't do the heavier impact, like a little drop jump off of an 8-inch step with a rebound is a classic example. There are like less intense forms that still create that type of impact that can stimulate some bone density at the hip. So my favorite example is heel drops, which I know Sid has recommended to clients for years, which is you basically go up on your tiptoes and then drop down on your heels. And that can be a nice alternative for people who, maybe are getting back pain with the jumping, or even women who have prolapse and urinary, leakage
Right.
when they're trying to jump. It's just a little bit less intense, but still kind of is creating that impact.
That was one thing you brought up as a rebounder. A lot of my patients have a rebounder. Do you think there's any evidence to using a rebounder, that being beneficial?
There are studies on this, but a lot of people feel like it's easier on their knees. There's a limited amount of research on this, but it's not as effective as land-based jumping, but does improve strength in the lower extremities, can help with parameters of balance, and has some bone health benefits. It's just not as much as land-based jumping. But again, you have to meet yourself where you are and give yourself some grace.
I'm trying to be sensitive to your time is valuable and our listeners. So thank you very much for coming on today and just promoting your awesome book. I really do think that this complete bone and joint health plan, this is what it looks like, everybody. This should be on your shelf. And thank you, ladies, for your time.